I mean, ultimately, we want the doctor-patient relationship to be open enough so it can be spontaneous, the physician can relax, and the patient can relax, and they can interact in such a way that a therapeutic involvement is occurring. If it was too rule-bound, that would scare both of the participants. But on the other hand, if there's not enough of a structure, then what can happen, and what does happen, is that there's a relaxation of a sense of what can happen, and people can cross boundaries in a negative sense. Now, it's important to recognize that when we define crossing boundaries, we don't mean that crossing boundaries is necessarily bad at all. In fact, crossing boundaries can be neutral, it could be good, it could be negative. It's when we talk about boundary violations that we're talking about something that is intrinsically negative and destructive to the patient. So we need to have enough leeway for doctors to be able to, in a sense, cross boundaries in a way that somebody might consider, well, that's not what I would do, but that doesn't mean that it's inappropriate. I mean, one of the things, let's say if a patient is stressed out about a particular topic or a particular issue in their life, a physician might have compassion for that, and they might go out of their way to help the patient by giving them a book. Not suggesting a book, giving them a book. Now, this would be considered a boundary crossing. It's not the typical way of practicing medicine. It could be very expensive to keep giving books to patients. So right away, the authorities might consider it inappropriate at some level. They might wonder why this patient and why not some other patient. So it would be considered in terms of the practice of let's say, most of medicine, it would be sort of considered a little bit crossing the boundary. Now, that doesn't mean it's a violation, it doesn't mean it's harmful, but it could be. And then certainly you wouldn't want to just do that without thinking. So that would be an example of a boundary crossing, which is acceptable, but problematic. It could be problematic because what does it mean, and what does the patient take from it? It's like, what if it's a young woman, and what if the doctor is a male, and an older male? And so it could have other meanings that are not apparent right up front. On the other hand, a boundary violation would be going significantly farther and using the patient for the physician's own needs. And one of the things in medicine, one of the fundamental things in medicine, is that we're there for the patient's benefit. We are there to help the patient. Now, our needs are still there a little bit, but not too much. Our needs are there to help the patient, so we have that. We also get paid. And also, we don't have to be so careful as to be of danger to ourselves. In other words, if the patient is actually dangerous, then we can actually set boundaries and even cross boundaries, and if they attack us, we're allowed to defend ourselves. But other than that, Derek, we're supposed to not be there in terms of our own selfish needs. And so a violation is using the situation with a patient, using the relationship with the patient for the ends of the physician, not the patient. So if we keep that in mind, if we keep thinking about, is this good for the patient, we're apt to never cross boundaries in a violation.